Eating disorders come in all shapes and sizes. Not every patient suffering from an eating disorder will be underweight, and not every patient will present with the same symptoms. Even though an eating disorder may be difficult to detect by just looking at the patient, the consequences are nothing less than real. Left unchecked, they can quickly become life-threatening, and even once treated may lead to long-term consequences. Symptoms or clusters of symptoms can help point a clinician towards a life-saving diagnosis. Through examination, many clues may present themselves. Please keep in mind throughout the remainder of this video that the characters portrayed are not meant to represent the physical characteristics of those suffering from eating disorders. All eating disorders can and do present in people of all shapes and sizes. Anorexia nervosa and avoidant restrictive food intake disorder both involve a restriction of caloric intake, and the clinical signs are similar. The first symptoms are often weight loss, sudden changes in eating behaviors, and with anorexia, body image disturbances. As the condition progresses, the lack of ample nourishing food causes the body to react in several distinct ways. Malnutrition causes the muscles in the body as well as the walls of blood vessels and veins to deteriorate. The resulting poor blood circulation can lead to edema, lanugo, the growth of a fine hair may appear on the face, back, or chest, and skin may appear dry or discolored. Bruises may also occur more easily, and wounds heal poorly. Hair and nails can appear dry and brittle. Hypothermia may also be present. Blood tests can reveal low normal T4, low estrogen, LH, FSH, and anemia. There may be a disruption in a patient's menstruation and even premature osteoporosis. It only takes about 6 months of poor nutrition, especially diets low in calcium and vitamin D, before patients experience osteopenia, the precursor to osteoporosis. Even after a patient has recovered from the eating disorder, they may experience permanent and irreversible bone damage. Observing a patient's demeanor and asking questions regarding mental health, you may notice such things as a distinct lack of energy, symptoms of depression, anxiety, or even substance abuse. Restricting caloric intake has also been known to decrease overall brain mass, leading to cognitive impairment. People with binge eating disorder can present with symptoms including high blood pressure and high cholesterol levels. Heart disease can develop as a result of elevated triglyceride levels, as well as type 2 diabetes and gallbladder disease. Patients often complain of joint and muscle pain, shortness of breath, and sleep apnea. With bulimia nervosa, patients may exhibit an entirely different set of symptoms due to their purging behaviors. While usually within normal weight range, weight fluctuations can be an early warning sign. There is a potential for gastric rupture during periods of binging and inflammation and possible rupture of the esophagus from frequent vomiting. Frequent release of stomach acids during vomiting can lead to tooth decay and staining. As a result of purging behaviors, an electrolyte imbalance can occur from dehydration and loss of potassium, sodium, and chloride from the body. Electrolyte imbalances can lead to irregular heartbeats and possibly heart failure and death. Chronic irregular bowel movements and constipation occur as a result of laxative abuse. Peptic ulcers and pancreatitis can also be present. As with all forms of eating disorders, the co-occurrence of depression and anxiety is common. Symptoms may occur independently or in clusters. Once these conditions are visible, it's likely the eating disorder has significantly progressed. Patients likely have suffered with eating disorder thoughts, self-loathing, and high anxiety for months or possibly years before physical signs and symptoms are noted. Unlike most other medical conditions, individuals suffering from an eating disorder may be hesitant to acknowledge or change their condition. Early intervention is key to the success of the patient, so spotting these warning signs is critical. Because any eating disorder can present in people of all shapes and sizes, early intervention and ongoing treatment success requires medical professionals to suspend assumptions about eating and exercise behaviors based on a person's weight and assess for all eating disorders across the weight spectrum.